Welcome to our event tonight. Don't let COVID delay your mammogram. My name is Frances. Good night. Just wanted to say hi to everyone as you are joining us this evening. Thank you for taking some time out to spend with us tonight. We are so very glad that you're able to join us. This program is being put on by Sister Give Me Your Hand, which is an initiative out of MD Anderson Cooper Cancer Center, as well as Weill Cornell's Meyer Cancer Center, specifically out of New York Presbyterian Brooklyn Methodist Hospital. And our program, Sister Give Me Your Hand, is focused on educating Black women about their risk for breast cancer, increasing access to breast health resources for Black women, and empowering women to take charge of their health. We're very happy that you're able to join us tonight. Tonight, a special guest from MD Anderson Cooper, Dr. Carter, will be speaking with our group. So please pay close attention. If there are any questions or anything that comes to mind, please send us a message in the chat so that way we can answer later on in the Q&A. Without any more chit chat from me, I'd like to welcome Dr. Carter. Dr. Carter, you're still muted. I'll go through the agenda really quickly. I just wanted to welcome everyone. We're gonna start with a facts and myths session. So we're gonna ask you, what do you think about 3 different statements? You tell us if you believe that it's true or if it's false. Then Dr. Carter will go through some of the myths that are surrounding breast cancer, the importance of screening, addressing any barriers and the impact of COVID-19 on going to get screened. And then she's going to discuss some of the important facts about screening rates and breast cancer, especially as it pertains to disparities that exist with Black women as opposed to other women of other racial groups. And then we're gonna close out the program with a moment in the mirror with Diane Hyman, who is also a special guest from MD Anderson Cooper, and we'll answer any questions that you may have at the end. And then we'll just ask you a few questions so that we can improve the next session that we will be having. So thank you so much for joining us tonight. For anyone that hasn't joined us, thanks that didn't hear my introduction before. Thank you for joining us. And please, I just want to remind everyone, write your name in the chat so that way we can take a note of who is here tonight so that way we can enter you into the raffle. Please do not forget to write your name in the chat so that we're aware who's here and we can announce the winner at the end. Thank you so much. And now Dr. Carter will be taking over.
Okay, we're gonna start with some polling here. All right, so let's start with our first poll question. So the first question, wearing antiperspirants or deodorants can cause breast cancer to develop because they block the body from getting rid of toxins. Everyone can go ahead and vote on that. I can see how many people voted, so I'm just gonna give you a couple more seconds. Okay, so most of you said that was false, and that is correct. I apologize. They do not cause breast cancer. Sweat contains water, urea, and salt, but it doesn't contain any toxins. And sweat glands aren't connected to the lymph nodes, so it couldn't transmit anything to the lymph nodes to cause the cancer. Let's go ahead and put up our second question. Bras constrict lymphatic tissue, allowing cancer-causing toxins to build up, and this can lead to breast cancer. Everyone can go ahead there. So most people said that that was false, and those of you that said that are correct. Bras do not interfere with lymphatic drainage at all. Wearing your bras at night or underwire does not increase your risk. Bras are actually very good to help you with things like breast pain. So no reason to not wear a good tight fitting bra that keeps you comfortable. Let's go ahead and put up our third question. A mammogram is low dose radiation that can find a change in the breast tissue when it is very small, often several years before a lump can be felt or palpated. And Most of you said that was true, so good. So the amount of radiation used in a mammogram is very small and safe and helps us to see things before we would be able to see them otherwise. All right, so let's get into the talk about breast cancer. How common is breast cancer? Breast cancer is the most common cancer in women, in American women after skin cancers. It is the most common cancer among Black women in the US, which is important to us. And 1 in 8 women in the US will develop breast cancer at some point in her lifetime. So in 2020, we estimate that over 325,000 new breast cancers will be diagnosed in women. It's the second leading cause of death from cancer in women, but the good news is the death rate has decreased, believed to be the result of finding it earlier through screening, increased awareness, and better treatments. And that's why we're here tonight. There are more than 3.5 million breast cancer survivors in the United States, and we'd like to keep that number growing as we find more cancers in the coming years. Black women are a high-risk group for breast cancer. In the US, Black women are about 40% more likely to die from breast cancer than white women. You might ask why that is. And there are a few things that contribute to that. For one, Black women are more likely to get breast cancer at a younger age. When we look a little deeper, we also find out that these tumors tend to be a little bit harder to treat, and they present at higher stages than we find them in white women. Research found that Black women often have delays in their follow-up care after mammograms, and this can be due to lack of access to transportation or insufficient appointment availability. This isn't always the fault of the patient that they can't get back to get the follow-up after they have their mammogram. So step 1 is having a mammogram, and then step 2 is getting back to do the follow-up appointments, biopsies, whatever else is needed to find out what's going on. Therefore, we have screening recommendations from a multitude of cancer societies and the U.S. Preventative Service Task Force that tell us what we should be doing to screen so that we can find these at an early stage. So there are screening recommendations for many age groups because cancer, while it is most common in the 60s, so when you're in your 60s, that's the most common time to present with a breast cancer. It can happen when you're younger and older. So for those patients who are ages 20 to 39 years old, we recommend for screening monthly self-breast exams and clinical breast exam by a health professional every 3 years. Monthly self-breast exam really just means that you should be aware of your breasts. I always tell people, you live with them every day, you're going to be the one who knows them the best. So if you feel something that seems different or strange or weird, it never hurts to ask. Even you saying, I don't know how to do it correctly, it's still okay to try and feel what your breasts feel like and to know that your breasts will change throughout the month based on your monthly cycle. For women who are in the age group 40 to 49, we talk about, again, doing monthly self-breast exams and then yearly clinical exams by a health professional, as well as starting a mammogram at age 40. We recommend one every year to every 2 years, and that a little bit depends on your risk. For those women who are ages 50 years old and above, again, continue knowing your breasts, and then a yearly clinical exam also, and yearly mammogram. Women who have higher risk for breast cancer from a family history or previous biopsies should be getting a breast MRI and mammogram every year, which is typically starting at about age 30. So I'm going to talk about misconceptions about screening for mammograms. So I'll start with, if I don't have any symptoms of breast cancer or family history, I don't need to worry about having an annual mammogram. Well, that's false, because the majority of breast cancers have nothing to do with family history. And we screen so that we can catch things early before you start having symptoms. Up to 10% of breast cancers may be related to genetics, but most other people will not have something in their family history that makes us think that they should have a breast cancer. Let's talk about how mammograms expose you to radiation. So some people think a mammogram will expose them to an unsafe level of radiation. Traditional mammograms are very low dose and unlikely to cause you health problems, even if you're having them every year, or if something is seen on a mammogram and you're caused to have one more frequently than once a year, it's still safe. And then when we talk about different types of imaging that we can do, there are different types of mammograms. So another thing that we talk about is a 3D mammogram. So some people think a 3D mammogram is the same as a traditional mammogram. 3D mammograms give us more information and increase the detection rate in breasts that are more dense. Also known as tomography, the machine takes pictures from many angles to create a 3D picture to look at your breast. Some more misconceptions. I had a normal mammogram last year, so I'm going to go ahead and skip this year. I don't need to have another one. This is not true. This is the reason that screening protocols are put into place. It's to pick up new abnormalities when they're still small. Again, screening is designed to pick up cancers very early before they're going to be a problem. Next myth. If I have any type of cancer in my breast tissue, a screening mammogram is guaranteed to find it. Many people don't know that you can get called back for more images. And oftentimes more images are needed to make a final decision as to whether or not something is a problem that we need to biopsy or something that we can just watch. So these more images might include getting a diagnostic mammogram where they take close-up pictures of a certain area. It might include getting an ultrasound. And it could even be something like an MRI before and or after you get a biopsy. Some patients come in and they say, my doctor didn't tell me I needed a mammogram, so I can't schedule one. Ooh, I apologize. This is also not true. You can get a mammogram if your doctor didn't tell you you need it. You will have to go through a provider to get it, but we can get it done for you. And then another thing that I hear quite a bit is if I get a biopsy, it will cause cancer to spread if I actually have cancer. In breast cancer, that's just not true. In some cancers, it is the case, but breast cancer, it has been proven through research that a biopsy is a very safe procedure and does not cause an upgrade in your cancer. It doesn't cause it to spread to anywhere else. Mammograms are a very low dose of x-rays to the breast. They help us find breast cancer at an early stage when treatment is most successful. It can also find breast changes that could be cancer years before physical symptoms develop, and that's when we want to catch it. So let's move on a little bit and talk about COVID-19. It has changed the way that we all live our lives and will continue to do that for some time to come. It's caused us to have some increased safety precautions in everyday life, not just in medical facilities. But also when COVID first hit, everything sort of shut down. So things that were considered elective, which is including screening mammograms, stopped. And we sort of changed a little bit the way we prioritize certain treatment plans in breast cancer. So what this means is that before COVID, we know that we had documented delays in diagnosis in Black women because of screening delays, following up after screening, not being able to get to appointments, not having people follow up to get them back to their appointments, and delays in screening and diagnosis lead to increased stage at the time of diagnosis, and we know that leads to worse outcomes. So if you look at the chart that I've put here, we can divide breast cancer into local when it's small and early, regional when it has spread to areas that are close to the breast, and metastatic when it's gone to other places in your body. If you look at the bar for local, survival is darn near 100% for those patients. But if we wait until we get to a regional disease, the 5-year survival decreases quite a bit. So we're trying to make sure that while we're screening, we're catching everybody in this local time period where we have the best outcomes when we treat them. During and after COVID, we know that there was decreased radiology screening availability during. Now we're opening up more. People can come and get their screening done, but some patients are still avoiding medical offices. This, again, can lead to increased delays in diagnosis. If we look at some of the data, we can compare what's been going on this year since COVID hit to what was happening in 2019 in the same time period. Screening has dropped more than 50% since 2019 in the same scheduled time. And also diagnoses have dropped by approximately 50% since that time also, That doesn't mean that we actually have 50% less cancers. That just means they're not being diagnosed. And at some point we're going to see them, but they're probably going to be a more advanced stage than if these patients had come in and gotten their screening imaging. So what can we do now that we know that COVID-19 is causing these problems that are outside of just COVID that are affecting other areas of our health? So one of the things that we can do is know the symptoms. There are a ton of symptoms, and we associate all of these symptoms with some other illnesses too, like the flu. Some of them can be allergy symptoms. Some of them can be the common cold, but we should still review some of those. So cough, fever, shortness of breath, loss of taste and smell, sore throat, nausea, vomiting. You can also have diarrhea associated with COVID. Because we know the symptoms, we know some things that we can do to try and mitigate the spread. Wash your hands, wash your hands, wash your hands, and wash your hands some more. Maybe keep some lotion on the side so your hands don't get too dried out. Cover your nose and mouth when you're out in public or around people you don't really know. And social distance, stay far away from people. If you are at risk or come into contact with someone who is at risk, it's important for self-isolation and quarantine if necessary. What's happening in the medical offices that make it safe for you to come in? For patients, they all have masks are supposed to wear masks at all times when they're in our facilities, and there's hand sanitizer stations set up all over so that you can continue to wash your hands. For providers, we're all wearing masks. We're all wearing face shields or eye protection. We're all washing our hands, washing our hands, washing our hands. And there's a lot of cleaning of areas that are frequently used. Screening is open. You can come in. Patients are screened even before they come in. Once you get an appointment, at least here at Cooper, you get a phone call to make sure that you don't have any symptoms. And then you're also screened at the door, and your temperature is taken before you come in. So let's talk about breast cancer numbers, because this is important too. Excuse me a second. I'm not used to talking this long anymore, I guess. As we said, there's going to be more than 300,000 new diagnoses of breast cancer in the US this year. In New Jersey, what that looks like is about 8,000, 8,000 diagnoses this year. And in New York, that looks like about 17,000. So that's the whole state. If we break it down a little bit further, we're talking about sort of two areas here. In New Jersey, the highest incidence of breast cancer is in white females, which that is in New York City too. And that's a trend that we see around the US. However, the death rate, the mortality is highest in Black females. And so what we want to do is, if we can get to the cancers when they're earlier, we should be able to decrease that death rate. Excuse me. And the same thing is happening in Brooklyn. All right. So in Brooklyn, we see that white patients survive about 3 years longer than Black patients from their breast cancer. Monthly self-exams, knowing what's normal for your body. So knowing, as I said, you know your breast best. So knowing what's normal for you, keeping up with your exams with the doctor, and mammograms after the age of 40 annually. In addition, ways to reduce your breast cancer risk: maintain a healthy weight and exercise, eat a healthy diet, limit alcohol consumption, and don't smoke. Excuse me, we're going to transition to our moment in the mirror now.
Hi, everyone. Can you hear me? Can you see me? For some reason, I can't see everyone. Hi, welcome, everyone. Thank you for that presentation, Dr. Carter. Thank you guys for joining us all. I'm Diane Hyman. Francesca, are you okay? I'm Diane Hyman, and I am one of the nurses at MD Anderson Cancer Center as well. And we thank you again for joining us. And we just wanted to just encourage you this evening. And we were doing this moment in the mirror. And if you can all see yourself, can you all see yourself? Can you all see it in this Zoom? You can unmute yourself. Can you guys hear me?
We hear you, Diane.
Okay. Can you all see yourself in the Zoom?
Yes, we're seeing our reflections in the video.
Your reflections, because I want you to, as if you're looking at yourself in the mirror, to see yourself. It's easy for us at this time, especially to feel settled and complacent. There's many reasons for us to feel stuck and discouraged and lack enthusiasm. But now more than ever, in the era of COVID and breast cancer, it's time for us to really take charge and to stand up and be a voice in our own advocates. And so we all as women play many roles, but with each role, it's imperative that we continue to inspire someone else, try to inspire someone around you. Diana Carroll, who was the actress, those of you may be old enough to remember her, she actually succumbed to breast cancer, but she had this quote that I like. It said, "In the war against breast cancer, we have the ability to arm ourselves with knowledge, and education is a powerful tool." And just like you came this evening to gain more education, education really is a powerful tool. And she goes on to further say, by taking action and doing something positive, fear is replaced with hope. So it is our hope that this evening that you gain education and that you are inspired and that you gain hope and want to take charge of your health. And so when we talk about look at ourselves in the mirror, and I want you to look at yourself on this Zoom. I can't see you, but you can see yourself. Look at yourself in the mirror. We always look at flaws that we have. We may say that we have wrinkles or my nose is too big or whatever we may say when we look at ourselves in the mirror. And we also can look and kind of tell our younger selves a whole lot of things, that some choices that we should or should not have made. But tonight, we want you to look in the mirror and don't focus on your flaws. Don't focus on your past mistakes. But we want you to look into the mirror and truly see just how special of a woman that you are. And I want you to see yourself through the eyes of God. And when we do that and realize that we are created in the image of God, that we lack nothing. And so I want you to say that, unmute yourself and say, I lack nothing.
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 Yes. And it's so imperative. I'm a firm believer of affirmations. I speak affirmations over myself every day. And so I want you to repeat after me as we say we lack nothing. I want you to say that I will, and to your health, we're hearing about taking charge and command and how it is to take charge of our health. Say, I will not be complacent.
I will not be
Complacent.
I have power in my voice.
I have power in my voice.
I have power in my voice.
Yes, I will stand bold.
I will stand bold.
Yes, I am beautiful.
I am
am
beautiful.
Beautiful.
I am blessed.
I
I
am
am
blessed.
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 I have hope.
I have
I have
hope.
hope. Have hope.
And I will take charge of my health.
And I
And I
And I
will
will
take
take
charge of health.
charge of my health.
Declare those things and speak them and then say your name. I am Diane.
I am Anita.
I am
I
Lisa.
am Brianne.
Yes.
Iris.
Amen. Yes. Taking charge and speaking positivity and affirmations and encouragement over yourself and over your health, and knowing that you are your best advocate. And so I thank you for that moment of reflection in the mirror, and I hope that it inspired you.
Thank you so much, Diane, and thank you everyone for participating. We're gonna do the question portion of our session tonight. So I just wanted to see if anyone had questions. I know we had 2 questions that were typed into the chat. So if anyone has any questions and would like us to ask Dr. Carter your questions, or if you'd like to come on and speak with Dr. Carter directly, please let us know. We'll start with the first question. So Hyacinth, thank you for your questions. She asks, is mammogram a risk factor?
If you mean, is mammogram a risk factor for getting cancer? The answer to that is no. Many of the risk factors include things that we can find on mammogram, but the added risk of a cancer developing from the radiation from a mammogram is probably about the same as your environmental exposures. If you've ever flown anywhere, or if you spend a lot of time out in public, there's radiation there too. So it wouldn't be much higher than that.
All right, thank you, Dr. Carter. And I think Hyacinth's second question was what procedures are available when there is tissue change but no lumps in the breast?
When there's tissue change but no lump, oftentimes how we find it is on the mammogram and we can't see it on an ultrasound. In that case, we would do a biopsy using the mammogram. We call that a stereotactic guided because we use the mammogram itself to show us the area where the biopsy should be performed. Or if we need to, we could even move on to an MRI and do a biopsy that way.
Okay, thank you, Dr. Carter. Does anyone have any other questions for Dr. Carter about what we discussed tonight? What can we do to encourage Black women to get screened? So what can we do to encourage our sisters, our mothers, our cousins? What can we do to encourage Black women to be screened? Dr. Carter.
I think, we as a community have to be able to lift each other up. And so when you say to your sister, your mother, your friend, hey, I'm going to get my mammogram, you should go get yours too. We're all going to be healthy together. That's powerful to be able to say to the other people in your community and that you're close with that I'm doing this and there's not a problem with doing this. And that helps people accept that this is something that's going to help their health and help them for their life. So the first step is with you, essentially.
All right, I wanted to see if anyone else had any questions for Dr. Carter tonight before we ask you to share with us. Oh, okay, we have another question in the chat. Vanessa, do you want to explain that question? I'm not really sure I understand what.
Okay, all right, I'm here.
Okay.
I was also asking, thank you for the information. My name is Vanessa Farrell. I also wanted to maybe have Dr. Carter talk a little bit about men at risk and how can they also at risk for breast cancer as well, and what do we as girlfriends, wives, whatever, how do we encourage that conversation as well with the opposite?
Okay. Men are indeed also at risk for breast cancer, but their risk is more likely to be genetic related than it is for women. So men are less likely to develop a breast cancer. Part of that is because they have much less breast tissue. So they're going to present with a problem, and it's not necessary to screen men. So really with men, self-awareness is the biggest thing because they can say, oh, something hurts here that's not supposed to. I feel a mass. My breast is growing. There's some bloody discharge. If you heard Beyonce's father, when he was diagnosed with breast cancer, it's because he had bloody nipple discharge. He's just someone that's been in the news more recently. I think his diagnosis was big last year around this time. He was talking a lot. And so you just have to talk to men about it. It's more of a, is anything different with you? And so it's a general health thing with men. They need to be, you know, going to see their physician. They're not as good as at women as going to see their primary care every year and getting their general physical and sort of being aware of what's going on with them or not dismissing what's going on with them. So just supporting them to stay healthy and to stay aware of everything that's going on with their body is what we can do about men.
All right, so we have another question in the chat, and that question was about treatment options. So what's the difference between radiation and chemotherapy?
Okay, so when I start the conversation about treatment for breast cancer, I start with the fact that there are two different ways that we treat breast cancer. The first way is locally, so that's in the breast only. And the second way is sort of globally, which is treating your whole body to treat things that we can't see. Things like surgery, such as a mastectomy, which would be removing your breast, or a partial mastectomy, which is removing part of your breast, are local treatments. Same with radiation. Radiation treats a specific area and not your whole body. Chemotherapy, on the other hand, is a full body treatment. So that treats from the inside out. Radiation and surgery treat from the outside in, sort of. And then chemotherapy is a full body treatment from the inside out. That's sort of the quick version of that. To talk about all the treatments would be a much longer conversation. But that's kind of the basics I can give you.
And we plan to have another session where we talk about different treatment options. So this is something that if you're interested in having a follow-up session with Dr. Carter or another clinician, we can definitely have that as a topic for another session. So I have another question for you, Dr. Carter. And someone is asking that, so someone said that their breast tissue has continued to change. How long after treatment should she expect this to continue?
At least 6 months, we expect to see the breast tissue changing. And that's sort of the first time period where we start doing follow-up imaging. Once you've completed treatment, about 6 months after, we'll start doing some follow-up imaging. And we do it sort of at close proximity for a couple of years so that we can track the changes and make sure that nothing that's changing is concerning to us or to you. So it'll be a little bit that you're going through some changes with your breast tissue, but it will even out at least after a couple of years, but it could be faster.
So someone asked, my mother had breast cancer when I was 12. My sister and I have not had breast cancer. We are both over 60. What are our chances of getting cancer?
It's a little bit more complicated than just your mother had breast cancer when you were 12. So based on the fact that you were 12, I'm betting your mother was a little bit young on the younger end when she had breast cancer, and I hope she did well with it. But for those people that have breast cancer at a younger age, they have a little bit higher likelihood of having a genetic predisposition. But without genetic testing, I can't say for sure what your actual risk is. As we get older, our risk of breast cancer goes up. So the average age of a breast cancer diagnosis in the US is somewhere between about 62 and 65. So you're in the sort of highest risk group, but I can't say for you specifically without getting a little bit more information from you if your risk is higher than average. So I would continue with your yearly mammograms and making sure you're seeing someone to have a breast exam by a clinician. And that's sort of the best way for us to find out if we're going to catch something early.
Mm-hmm.
Thank you, Dr. Carter. So someone else had a question. What additional precautions should one take after inconsistent mammograms? For example, I had one this year and it's been a few years since my last one. Should I now get another one? So I guess she hasn't had one this year. So, and it's been a few years, so should she get one now? If that's not correct, you can always hop on and ask Dr. Carter the question.
So if it's been a few years since you've gotten your mammogram, definitely go and get one now. As I've said, it is safe to go and get your screening imaging done. And the best time to do it is now. You shouldn't wait. If the question is you had one a few years ago, waited a few years, and then got another one now, and it was fine, then you just need your next one in a year. There's nothing extra you have to do, as you just need to get back on a regular schedule, essentially.
One last question. It's more about treatment and lumpectomy versus mastectomy. Dr. Carter, can you answer that real quickly? The difference between lumpectomy and mastectomy?
Gotcha. A lumpectomy just takes out the cancer in the area around it. A mastectomy would take the whole breast. Sometimes we have to do a mastectomy because of the size of the cancer or the size of the breast does not allow us to do a partial mastectomy. But the outcomes in both of those surgeries are equivalent long-term. So we do try to preserve the breast if that is your preference when you're planning a surgery, if at all possible.
Okay. Thank you. So again, thank you all for participating. We appreciate you taking your time. One of the things that Frances mentioned at the top of the call was that this program is sponsored by Cooper University Hospital and Cornell Medical Center in New York. And the name of our program is Sister, Give Me Your Hand. And so the whole point of Diane's presentation and Dr. Carter's presentation is to really encourage African-American women to be screened for breast cancer. We have a lower incidence, but a higher mortality. So we really want to be able to talk to our sisters about the importance of breast cancer. So we thank you so much for taking the time to join us tonight. And please stay tuned. We'll continue to bring programs like this to you.
Just a fantastic job. You all have really sort of taken the time to do what's important, which is to discuss breast health in our communities. Sorry I had to join a little late, but I am certainly looking forward to the upcoming sessions that we have. I see some of the questions that are coming through. They are fantastic questions, so we will address those. And I always encourage all participants to think about not only getting a mammogram, but to encourage 7 other women or 8 other women to go get a mammogram. So your sister, your cousin, your sorority sister, your church friend, your grandma, your mama, okay? Go and encourage everybody to get the mammograms despite COVID. Y'all have a wonderful night.
Thank you everyone for joining us.